Hi, I'm Dr. Skip George, La Jolla Sport and Spine. Today's topic is the diaphragm, the most important muscle in our body. And I mentioned before, the diaphragm connects to our sternum, our rib cage, back into our lumbar spine. And that's really significant because on one side of the spine, one side of the diaphragm on the left side is a little bit smaller and weaker. It's a little flatter as well. On the right side, that diaphragm, it's in a little bit better position to breathe actually. It's bigger, it's stronger, there's a liver right underneath it to make it dome a little bit better. Doming is a good thing. The reason doming is a good thing is that means that the diaphragm is relaxing and then it's able to draw air into the lungs when it contracts and flattens out. The problem is we are all born with asymmetries. Smaller diaphragm on the left side, bigger diaphragm on the right side. That connection to the lumbar spine has a tendency to pull us to one side. And that's actually a good thing, especially if we're walking. You need to be pulled to one side. But typically what happens, we get too strong. There's a tug of war between the right side and the left side, and the right side usually wins. Even if you're left-handed, the right side usually wins. So part of the task when we talk about rehabilitation goals is to, and also performance goals, whether you are a little league player, a soccer player, or a major league pitcher, the goals really are the same. And they are to help you reposition yourself where you're actually able to take that flattened diaphragm on the left side and actually make it dome, make it relax a little bit more. The diaphragm is a muscle of breathing in, inspiration, but it's not a muscle of getting air out, of exhalation. So when we talk about the core, really what we're talking about in this context is that we want to use the abdominal muscles to bring the rib cage down, especially on the left side, to oppose the diaphragm or make it relax on the left side more. So when we breathe out completely and bring that left rib cage down and learn how to do that with all of our activities, then we have a more balanced function. We're able to integrate the left and the right side of our body in a more effective way. So with the PRI approach, with this approach of affecting breathing, posture, and position, one of the goals is to get the diaphragm to relax and to have a more balanced role with not only breathing, but stabilization of the spine, the pelvis, the rib cage as well. So this is really a big deal muscle. If you get that diaphragm to relax, and you can get the air out and let your chest wall come down a little more effectively using these muscles of exhalation or your abdominal wall muscles more effectively, and training is required for all of us, then breathing becomes more natural. Your chest then becomes more spring-loaded when you want to just take a breath in because you've already learned how to get that breath out. You can take the load off of all these neck muscles that you'll see people when they take a breath in, they'll raise up, their eyes will get kind of big, and their neck muscles will bulge like, there's an alien that's going to pop out of there. So the goal is, number one, to get breathing where it's more natural and relaxed. Less tension. Take these muscles, the neck muscles, and even the back muscles out of breathing, especially at rest, and have a more balanced function of the diaphragm. When you do that, that affects your nervous system. It affects especially your fight or flight nervous system, the one that keeps you kind of tense and anxious. can bring that one down just a little bit or a lot. It affects blood pressure, blood pH, lymphatic flow, how you walk, all kinds of things. So we'll be talking more about the function of the diaphragm, corrective exercises, polyarticular chains of muscles. In other words, this is so fun because the diaphragm, if we're talking about the core, we're talking about the center part of your body, gosh, there are muscles that connect all the way up through your chest, your arm, into your neck, into your head, and then down your leg, all the way down to your feet. That's how important the diaphragm is, and that's how important getting symmetrical, balanced function is, and that's what we do here, what I do here at Hawaii Sport and Spine. Take care. Thanks for listening.